Before I introduce today's speaker, I would like to remind everyone that prior to tomorrow's program, there will be a healthcare awareness clinic in the Bonner Room in the Student Union Building from 9 o'clock to 11, sponsored by the NIC Nursing Department. Also, at Thursday's response panel, an 11-minute film presentation provided by the AARP will be shown. The film clip will detail their views on the national health care debate. I'm very pleased to introduce our guest speaker today, Mr. Dennis Wheeler. Mr. Wheeler is a native North Idahoan and a graduate of the University of Idaho, with degrees in business and law. He is currently chairman of the board, president and CEO of Coeur d'Alene Mines Corporation, president of the Silver Institute, chairman of the Western Board of Governors of the American Mining Congress, and a director for the Center for Democracy in Washington, D.C. In this capacity, Mr. Wheeler recently visited Russia. He is also on the board of directors for the Sierra Pacific Resources, a member of the board of the Wildlife Habitat Enhancement Council, and the founder and director of Coeur d'Alene's Jobs Plus. Mr. Wheeler has generously given his entire day to today's forum and will be a member of the 1 o'clock response panel in the Bonner Room. What does this man do for his spare time? Please join me in welcoming Mr. Dennis Wheeler.
Thank you. It's a pleasure to be back at North Idaho College again, and I was very pleased to receive this invitation because I do regard health care as probably this nation's top domestic issue today, and certainly one that has great significance in terms of the direction of our national economy. I believe that even without the initiative, frankly, of President Clinton, we would have come to this national debate in relatively short order, because health care certainly has been, over the last few years, of rising concern to members of the public, both in terms, I think, of cost and the question of availability of service. Having said that, I do want to also acknowledge that in my judgment, without question, we have the finest health care system in the world in the United States today. We have the most competent physicians, hospitals, and our pharmaceutical companies are certainly leaders of the world in terms of new medicines for all of us. So when we start to think about adjusting this system of ours, I think it's a process that has to be done very prudently, with a great deal of thought, input from the public, but hopefully with less emotion than we've seen this past year, because my experience tells me that judgments that are based on emotion are those that normally don't turn out to be the best solutions. And so I do acknowledge that the President, I think, has played a major role in terms of putting this issue out on the table for us, and I think it's healthy that it's happened. I'm not a doctor. I don't represent any insurance companies. I used to practice law and became involved with issues like medical malpractice some years ago. I don't do that anymore. But I am a consumer like you of health care, and I have the responsibility of looking out for 500 employees every day. And they are genuinely interested and concerned about this debate, because they currently receive through Coeur d'Alene Mines a fine health care insurance program. And when we pointed out to them in our discussions with the staff that some of the proposals that are currently pending before Congress will do things like tax you for part of the benefits that you now receive tax-free, or would require you to now contribute to a portion of the premiums that are now being provided to you by the company, or may in fact restrict the choice of the doctor that you can have to provide you with medical care. I can assure you that this has gotten their attention. They are actively involved in reviewing these proposals. They write letters to their congressmen, their elected officials, and they're becoming informed, like I'm trying to become informed on this important issue. And I'd like all of you in the audience to do the same thing, because it's truly an important issue, and it's one that has an important stake for our country, because after all, healthcare represents 14% of our total national economy today. And the consequences of restructuring this in an ill-advised manner could have far-reaching implications in terms of our lifestyle, jobs, and our country's economy. And in fact, the most recent statistics, I think, showed that the health industry's revenue run about $625 billion. That's $625 billion a year in our nation's economy. So it's going to be an extraordinary task when you start to reform something that has such national economic significance. And frankly, it's going to be more amazing to me if it's done in a way that is efficient and careful in the end and doesn't result in at least some adverse economic impact when I look at the proposals that are currently on the table. And we've got about 7 major proposals to reform our healthcare system on the table so far. And these are public policy proposals, and of course, anytime we deal with public policy, the results are not always predictable. And so it's really anyone's guess, I think, up to this point in time as to just exactly how this national issue will ultimately be resolved. But one thing is certain, it's an issue that's gaining a lot of attention of the public, and we're having a lot of input, and I think in the end that's going to result in hopefully the most healthy resolution of this issue. An example of, I think, the most recent change that I have seen was a proposal passed by the House committee that would provide universal health care coverage to all Americans and increased funding for Medicare. And when I saw this proposal and the House action, I said to myself, I thought one of the reasons why we embarked on this national debate and this issue in the first place was concern of rising health care costs to the tune of 15 to 20% a year. And one of the things that we had to do was bring the cost portion of our system under control. And it does concern me that most of the proposals that I've seen to date not only involve additional cost, but significantly higher cost to the system that we already have in place. And so I think we have to ask ourselves if in fact we're reforming a system because of concern for rising costs, does it make sense for us to enact a new structure or system that in fact is going to result in significantly higher costs, and will those costs provide added benefits to justify the increased cost? And finally, can we afford it? Can we afford, in fact, to incur significantly higher cost for medical care in this country when it's already consuming 14% of our total national economy? I do think that everything is negotiable in the process at this point in time, and President Clinton has acknowledged that, I think, many times, with the exception of the universal coverage for all Americans, and that's a point that he steadfastly has said from the outset is non-negotiable to him. But I think it's important as we go forward with these changes that we remember we're dealing with something here that involves more than number crunching, reorganizing scarce resources, or building new bureaucracies or governmental agencies, because really what we're talking about here is something that impacts all of us as human beings. And we as people are understandably concerned about our personal health, and it's a tradition that we have valued highly in this country, and we have enjoyed, and I think have insisted upon as part of our national medical programs in this country, that we have individual choice to go to the doctor that we have confidence in, that we are placing our trust in, to go to the hospitals that we know will provide us, in our judgment, the finest care that we can receive in the areas where we are, and that we have been in the past able to make our own decisions on these important points. And I think that this is something that we have to think about as we go forward here. How important is it to you to be able to choose your own doctor, to be able to go to the medical facility or clinic of your choice? Because in the end, most of the proposals that are on the table so far talk about limiting choice, taking away our options to go to the doctor of our choice or to visit the clinic or facility of our choice. And are we really comfortable about this? I think one of the reasons that health maintenance organizations, some of them are less popular than originally conceived, is due to the fact that many of these HMOs do not provide for choice of physicians by patients. And I would also like to, I think, point out to the people that are involved in this process, whether they're a government official, an elected official, or anybody in the healthcare industry, that I think the American public is intelligent. I think it's composed of intellectual members of society and people that are very capable indeed of sorting out what they want and what they expect. And I don't think that the public officials in this process should overlook the fact that they are dealing with very intelligent human beings as they go about crafting the solution to this issue. And I think that the traditional physician slogan, "to first do no harm," is appropriate to everyone that is involved in this debate. Now, the subject of this workshop today deals with public and private health care alternatives. And I do say that I believe that we should have and that we can have in this country universal health care. And in fact, I happen to believe that we're very close to it today. I think that the reality is that there are very few people in this country that are refused treatment by the medical profession. And I think the question of treatment, in fact, has to be kept separate from the question of insurance and coverages, because I think there's a tendency to confuse the two. The national accounting firm of Pete Warwick just released a report recently analyzing the president's proposal that estimated that it would increase the deficit of this country $280 billion through the year 2009. And when we think about the fact that one of the purposes of this exercise is in fact to cut costs, and when we all reflect on how concerned we have been in a nation about this country's mounting national deficit, I would suggest that we simply cannot afford a proposal that is going to add more than $250 billion to this country's deficit. There has to be a better way, and I do believe there are some other alternatives that do bear merit. And I would like to suggest today that most of the solutions to this debate should come from the private sector, because I think the private sector, more than the public sector, is concerned with cost management, with efficient delivery of services, and with issues such as quality, and providing self-initiative to the medical sector. And I think we have to be very cognizant of the fact that our country has operated from a spirit of competition and free enterprise from the outset of its creation. And we have had the most powerful country in the world and the most successful because we have relied on individual incentive and initiative in the private sector. And if we expect our health professionals to continue to deliver and provide us with the finest health care in the world, we cannot take away their initiative or their incentive. Now, we hear about exorbitant doctors' fees for drugs, and I'm not here to suggest that some of that doesn't happen, but I do truly believe that it is a minority of cases that really result in that kind of a thing. And if we as individuals expect to pick up the telephone to our doctor at 2, 3, or 4 o'clock in the morning and have him there to provide us with health care that we want round the clock, then we'd best be prepared to compensate these professionals for the extensive number of years that they require to become educated and the true time that they have to be available to us to provide us care when we need it. So we have to end up with a system that's going to continue to rely on incentive and initiative if we want to continue to maintain our lead in health care throughout the world. Now, we have basically 85% of the people in this country today that are covered by health insurance at some level. 85% of the general public. So I think it's important for us to start off with a recognition that we really are dealing with a small segment of the population that today does not enjoy some insurance coverage for their health care needs. We hear frequently the number that there are 38 million people in this country that have no health coverage. But I think it's important to us to analyze just exactly what are the components of this 38 million. I suspect that a large segment are like many of our young people here today in the audience that were no different than I was when I was in my 20s going to college. And that's that about the last thing on my mind back then was health insurance. Because frankly, I considered myself to be a pretty young, healthy individual, and I was more concerned with things like trying to buy my first car or going out on a date on the college campus than I was to pay insurance premiums on a monthly basis for health insurance, because I didn't expect that I was going to frankly become unhealthy. And so we do have a large segment of our younger populace that is making the decision that health care insurance is really not a major item for me today. And I don't fault them for making those kinds of choices because frankly, the statistics are in their favor that they're right. And then we have the segment of the population that is in transit from one job to the next that maybe has a gap in their insurance for a 4-month period of time. And the statistics show that most people who go without insurance coverage in this 38 million that desire it are those that are in transit from one job for another, most of whom are without insurance for a 4-month period of time, although some do extend to as long as 2 years. So I think we ought to say to ourselves in terms of this universal coverage question, all right, how do we bridge the gap so that people that are in transit from one job to the next rightfully have insurance coverage to take care of their needs during this critical period of job transition. But I think the main message here, based on everything that I have certainly read or heard, is that in fact the true numbers of people in this country that are without insurance are those people that in many cases have made a voluntary election not to pay for their own coverage because they don't think they need it, or those that with some relative adjustments in what we have on the table today in terms of availability can be covered, and they can take care of those few months in their life that the insurance industry or our national health care system today does not cover. And again, let's bear in mind the question of the difference between insurance coverage on the one hand and availability of health care on the other, because when I keep seeing on television these program segments about how our emergency facilities throughout the country are being overtaxed to their limits because people are coming in for relatively routine problems such as stomach aches, etc., rather than true emergency medical needs, I tell myself that many people in this country that have perhaps been thought to not have access to medical care are in fact being taken care of in our emergency centers throughout the United States. They're not being refused medical care. And I might suggest to you that I think this is one of the things that really needs fixing, because this is certainly the highest cost care. Emergency centers and units are very high cost, understandably. And if it's one thing that we as individual members of society that pay for health care can't afford, it's to have facilities like this abused by people that are coming in for relatively routine problems that ought to be seeing a physician rather than going into the emergency units of our hospitals. So some need to fine-tune the routes by which we funnel people for medical care. And I think it's interesting to me that despite the emotion that has come into this process, the polls consistently show that more than a majority of the American public is very content today with their health care. And I think for good reason. One of the things that I have to do in conjunction with my job at Coeur d'Alene Mines is travel abroad from time to time. And so I have the opportunity to talk to people about issues like health care in their country. We frequently hear that there are other systems that are better than ours, and we hear about Canada and we hear about Germany. With regard to Canada, it's interesting to me, for example, that near our Rochester mine in Nevada, there's a small town of Lovelock where many of the nurses on the hospital staff are from Canada. And they came to Lovelock because they didn't like the Canadian system. They didn't like the compromises that had to take place in terms of patient care, so they're down here in the United States as nurses. Another example, I happened to be sitting next to a young man flying back to the United States from Germany this past year, and he was a medical student on his way to Wisconsin to work in a hospital for the summer. And in the course of our discussion, he told me that his father was an orthopedic surgeon in Germany, but that he spent about a month a year in the United States. And I asked him why that was, and he was very candid with me in telling me that his father came to the United States to upgrade his medical education and experience every year because, without question, the finest orthopedic techniques in the world were developed here by our professionals in the United States, far superior to Germany. And when I hear these kinds of stories, I tell myself, well, you know, why is it that we are being told that our system here in the United States is inferior to those of other countries? Is this a motion that is designed to make us all think that we need change? Is it really well researched and documented? Or in fact, do we have, which I happen to believe, the finest system by far in the world today? Albeit, I will admit, one that has become expensive, and that's a concern, I think, to all of us, including myself. And I think that as a member of the public that's not directly involved in the delivery of these services to we, the members of the public, I think that one message that I would like to leave to the medical community and the providers today is that accountability and responsibility to the public are things that really cannot be ignored. And in my judgment, had the profession addressed some of these questions over the last few years and taken some of their own self-initiative to correct some of the concerns of the public, we probably wouldn't be where we are today with a public or political solution seeming to be the driving force here, because the private sector itself could have taken care of some of these concerns. And you know, that's not unlike the mining industry with which I'm associated with, because we for too long allowed ourselves to be disconnected to the public. And today we've got to spend a lot of our time telling people about why they need the mining industry. And so I can, I think, make the correlation between the pharmaceutical medical community and the general public, because I do believe that there has been a disconnect for too long to answer the public's concerns about these rising costs and lack of coverages in certain situations that have led us to seek more perhaps of a public solution to this question rather than leaving it totally in the hands of free enterprise and incentive. But one of the things we've been concerned about in this country the last few years is world competitiveness and our ability to provide people with jobs and maintain the highest standard of living in this country for the citizens of the United States. And in the context of that, I think it's important to recognize that there really are few industries on a worldwide basis that we are national or international leaders. And we have to protect these positions if, in fact, as we move forward, we're going to continue to sustain a national economy that is going to provide jobs for our young people and standards of living with which we are satisfied. And certainly one of our crown jewels in this regard has been the pharmaceutical industry of this country, where more than half of the new therapeutic drugs that are produced in the world every year come from the pharmaceutical industry of the United States. And in fact, when you think about it, it's really mind-boggling to me the new announcements that continue to take place about new medicines that are being created every year by our pharmaceutical industry that are really solving age-old questions and concerns about disease. And we have available today medicines and treatments that even 5 years ago people thought were not possible. So let us please recognize that we are indeed the leader of the world in terms of the pharmaceutical industry in providing new wonderful medications that make all of our lifestyles more comfortable and enjoyable. And we can talk about those isolated cases where drug companies price gouge, and there's no question there have been a few examples of that. But overall, I think we have to keep in mind the tremendous cost of research that goes into the development of these drugs and the long time period that is involved in gaining the approval through the FDA, for example, before these products can come onto the market, and that those companies are entitled to a reasonable profit for the hundreds of millions of dollars and the time that they expend in developing these truly new modern miracles of medicine for us that have significantly prolonged our life span here and have significantly increased the quality of life for the ill and the aged. And certainly, as I become older, I begin to appreciate more and more the fact that as I grow older, I'm going to have a more comfortable lifestyle than I would have had 20 years ago or 10 years ago because of some of these developments. And I think, when we really think about it individually, most of us come to the same conclusion that we're glad to see these enhancements that are taking place in these new discoveries, because they really do give us confidence that we're going to be much less susceptible to uncomfortable disease throughout our life. I think, unfortunately, there's a tendency today in our society to have our public officials react to polls. In fact, I think we're close to the point where our public officials won't act unless they see a poll that takes the American public's pulse as to how they happen to feel on a particular day about a particular issue. And I think we're all responsible for that in a way, because we tend to react emotionally to issues. And I think that one of the things we can frankly do to help with the solution of this important national issue is to get our public officials away from the daily polling process and really perhaps think in terms of devoting this time to maybe revisiting the laws that we have already on the books. You know, we have quite a system of laws in place now that govern health care in this country, and perhaps going back and revisiting those with some fine tuning might be a far more profitable solution for all of us than to scrap what has been the world's leading system and start all over again. And I certainly do believe that there's a much better answer than creating a new federal agency to handle national health insurance. I have had, I think, the benefit of a lot of experience in going to Washington over the years, and I have to candidly say that in my judgment, not many federal agencies work well in terms of either the timeliness within which they act or the cost effectiveness with which they manage their business. And so, and I think all we have to do is look at the other countries in the world where you wait several months for a surgery, for example, in a place like England, complaints coming out of Canada. If these systems all work so well, why is it that these people have these problems with lack of timely health care delivery and treatment of disease? And I think that we ought to think about that. Are we really prepared to enact a system here that is maybe going to delay significantly the time period that we can enter our hospitals for a surgical procedure or to get into our doctor to take care of what happens to be ailing us at the time? So I think I'd like to spend the balance of my time here today primarily talking to you about some market-oriented or private sector ideas to address this problem. In the 1980s, probably the best retirement vehicle that was ever created for we in the United States was the individual retirement accounts, or the IRAs. And literally hundreds of billions of dollars poured into the IRA from many Americans, because what it allowed us to do was to take tax-free dollars and sock them away voluntarily for our retirement. Unfortunately, Congress couldn't leave the IRAs alone, and when the Tax Reform Act came around, they decided that they needed more revenue for the federal treasury than to let the American public invest in their own retirements. And so they hamstrung some of the tax benefits of the IRAs to make them less desirable. And the result of that today is we have far little investment in individual retirement accounts. But having said that, certainly when the law permitted it, the American public responded very favorably to the idea of, yes, let me be responsible for creating my own individual retirement portfolio, and let me manage it the way that I want to manage it. And I say to myself, why can't we establish a similar account for our medical care? You know, the law in this country allows business to take business deductions as expenses for medical premiums for their employees, but they don't allow us as individuals to take deductions from our individual tax returns for medical premiums. And I say to myself, why should we have that? Why should we not as individuals have the same ability to obtain favorable tax treatment under our individual income tax laws that business has today? And so I would suggest that one of the things we could certainly do here is we could establish an individual medical insurance account similar to the old IRAs, and we could put tax-free dollars individually into those accounts to take care of our medical needs as we as individuals come upon specific situations. We would be in the best position to take care of our own needs because we could determine from these individual medical accounts how we wanted our dollars to be directed. There wouldn't have to be a restriction on the physician of our choice, the clinic of our choice, or the hospital where we sought these services, or the type of insurance if we wanted to purchase out of these accounts. But it would allow us as we desired, to draw on these funds paid into our tax-free medical account without penalty. And like the IRA, these accounts could be taken with us when we changed employment because they'd be our own individual accounts. So we wouldn't have to be concerned with what happens if we change jobs and we have this period of time where we're without insurance coverage because the account would go with us. Now, these accounts could also build interest. The corpus of the funds that we paid into the accounts could draw interest and be invested while they were waiting to be utilized in our medical care. So we would have an investment vehicle that conservatively managed could add to its total dollar value as time went on. Now, obviously, this kind of a system would raise the question, well, this sounds wonderful, but we all can't accumulate individual medical accounts that are going to take care of the catastrophic illness or that major surgery, that major medical event that truly cost hundreds of thousands of dollars. And my answer to that is that's true, but what we could do is we could combine this individual medical account with a catastrophic insurance policy that covers indeed the catastrophic accident or illness, and those coverages are available at very modest cost. And for example, they could be provided by employers to their employees as an adjunct or companion to the employee's individual medical account, so that we would in fact take care of that rare situation where there was indeed a major medical problem that an employee could not cover through his own funds in the employee's medical account. And of course, one of the great advantages of this is these would be pre-tax dollars to us because we'd be getting credits against, in effect, the income tax we're paying today. And so I would say, you know, rather than think in terms of paying the government and having the government turn around, manage, and then redistribute these funds to ourselves again, why not eliminate that? And why not go to a self-incentive system that allows us to make our own choices? I think there are some other advantages to this, and that's that we could eliminate the need for deductibles that are present in most insurance programs and policies today, because there'd be no need for the deductibility. The individual could take care of their basic needs through the medical account funds, and then we would have the catastrophic insurance layer on top of that to provide a full spectrum of coverage without deductibility. You know, whenever we have policies with deductibles, I think there are certain adverse consequences that flow from that. For example, let's assume we have an insurance policy that has a deductibility of $250, which means that we as individuals have to pay the first $250. I think the consequences of that are many times people put off the idea of seeking some preventive medical care or treatment or program because they say, I don't want to have to pay the first $250, so I'm going to forego this kind of preventive care or the cost of checkups. Now, this is fine in the short term maybe, but of course the long-term consequences of that we know are sometimes you're going to miss that early diagnosis of illness or treatment that in the end adds significantly to higher medical costs rather than taking a preventive approach. So in some cases, deductibility in itself is a feature of our present insurance system that needs to be addressed, I think, and the medical account would be one way to do this, because under an IMA approach, the incentive would be there to address disease and illness early on when it's least costly. And then you're going to have more of your dollars left in your account for future treatment. So you'd have an incentive under an individual medical account to seek early treatment and diagnosis and have the most cost-effective system. So I say, let's let individuals use their own pre-tax dollars to help solve this national medical issue of ours. But I guess when I say that, I ask myself, are we going to hear from our government? Well, we can't do that because it's going to result in a loss of revenue to the national treasury, i.e., we can't have our hands on it to spend for the people the way we think that it ought to be spent rather than leaving the choice in their hands. So I say, let's have a lot more discussion about the fact that is the private sector indeed the most effective way to go about solving this, or do we need to have Uncle Sam take care of this for us because we as individual members of society can't go about it constructively ourselves. With regard to the question of insurance, I'd like to turn to the question of malpractice insurance for physicians and hospitals. I used to be involved with Idaho Trial Lawyers Association, and I used to be one of those guys on the other side of the fence that represented patients against doctors. So I've seen, I think, both sides of this question, and I've formed some clear judgments about it. And I do believe we've come to the point where we can no longer expect our physicians and hospitals to be able to continue to pay significantly rising malpractice insurance premiums. The thing has gotten out of whack and it needs to be fixed. And I think it can be fixed by a combination of things that requires all sides to participate. First of all, I think the time has come when we have to put some liability caps, some ceiling on what a person can recover in terms of damages in a malpractice situation. Now, I do believe that it's important that people that have been truly wronged have legal redress here in the United States, and that includes areas of medical negligence, because after all, we have a system of justice in this country, the cornerstone of which is that an individual that is injured by property or person does have access to our legal system for redress. And I think it's important that we maintain that situation. However, I think that it's quite clear that some of many of the verdicts in these cases have become astronomical, out of emotion, and that it's time to put some safeguards into the system so that we don't turn off the incentive of our physicians and hospitals to practice and render us care. So I say the time has come to put liability caps on medical malpractice awards. And I think that we also ought to consider requiring plaintiffs who bring those cases and are not successful to pay the cost of the defendants, attorneys, and court costs. There ought to be, in fact, a monetary penalty for those people that bring unjust cases against a doctor or a hospital or provider of medical care. And that will serve, I think, the very healthy purpose of having lawyers and plaintiffs very carefully screen their cases and really make a judgment call as to whether or not they have a meritorious cause of action. And so I think that would have the healthy impact of removing some of this litigation, and that would result in lower premiums. Now, having said that, I don't think the medical profession or the health profession is any different than any other segment of our society. I think that most physicians are wonderfully trained, I think they're skilled, and I think they're very fine providers of service. But they're not immune from having bad actors in their midst, just like there are bad miners, there are bad lawyers, there are bad dentists, there are bad teachers. Every segment of our economy has people that don't perform. And while it's a distinct minority, I think it's a minority that has to be addressed more responsibly by the profession. And one of the things that the profession can do to help contain more reasonably the cost of rising insurance is to do a better job of policing their own and to discipline doctors that do not practice the requisite standard of care, and in some cases to remove them from practice altogether. Even though it's a very small segment of the community, it's a community that it's a part of the community that in my judgment the profession can no longer afford to have around. It's too costly, and let's face it, it results in members of the public that are being unduly injured because of inadequate standards of care. So although it's a small problem, in my judgment, it's one that the medical societies need to work on. But I think we also have to keep in mind that any time you have a profession that is leading edge in the world and new technologies are being introduced and new procedures are being developed, all of which extend our lives and the quality of our lives, that medicine is not an exact science. And there are going to be those cases, unfortunately, where as we move out into new frontiers, there's always going to be those rare cases when some people have unwanted reactions to treatment. And there's just no way that we can expect the medical profession or health care providers to insulate us 100% from those rare situations. There will be some unfortunate cases from either drug reactions, medical procedures, etc., that just simply cannot be avoided, but that's the cost, that's the human cost that we have to have as we move forward and continue to develop the finest care. And so maybe we need in our insurance scheme to take care of those few cases. And obviously, if any one of us as individuals found ourselves in those circumstances, we wouldn't be pleased about it. But it is a recognition of reality that there's just simply no way to completely insulate society from a few unfortunate cases. And when those happen, we shouldn't point our fingers at the medical community or the providers of health care and say that they have intentionally or deliberately wronged us and put the thing out of the perspective, because it happens, in fact, I think, very rarely. But I would like to suggest that we as individuals in society do a very good job of making our own individual choices, and there's no reason why consumer choice shouldn't be the foundation of the resolution of this problem, because I really believe that we in this audience are as capable as determining the doctors that we want to see and the type of insurance that we want to have for ourselves and the type of facilities that we want to visit, just as we're as capable as going to Albertsons and determining which groceries we're going to buy, what car we're going to buy. These are all consumer choices. And I think if we keep it simple and understand it in that way, we're really talking about consumer choices of medical care. And I've got every confidence that we as individuals can make our own choices if we just take the time to educate ourselves and do our homework about who are the good providers of care in this community. And so I think that, currently our system today is based on a great deal of personal responsibility, both from a provider standpoint and from we as consumers. We can choose to go to where we go to purchase our drugs. We can price shop. We can participate in making the important decisions, and we do. And so I would just like to suggest that I think it's extremely important that as we go forward, we all insist to our elected officials that we want personal responsibility and choice as consumers to be built into into this resolution. And one question I might ask is, why don't we think about privatizing the government medical programs that are already in place? Because as I look at the numbers, I can't help but come to the conclusion that the government programs today are very inefficient. For example, when we started Medicare in the 1960s, it was estimated that Medicare was going to cost us nationally $12 billion a year. In fact, today, Medicare costs us $110 billion a day, or a year rather, and the costs are still rising. It takes about $3,300 for the average cost for a Medicaid recipient every year for medical care in this country. But the private sector, on an insurance basis, takes care of these same services for individuals for $1,500 a year, less than half the cost. And so I say to myself that perhaps one of the things we ought to be doing in conjunction with this debate is really examining the question as to whether or not privatization of some of these nationally provided programs isn't in order, because what we see happening now is cost shifting. The federal government recognizes that it can't continue to pay all of these costs, so it's putting the burden on the states. And we read about this all the time. It's been a problem here in Idaho the last few years, where the legislature and the governor have had to struggle with increased funding because there's been less federal participation. And now, of course, all governments are trying to put this back on they're trying to shift it even further down to the individual level, so we are having to pay higher costs. Now, while this is maybe unfair, I think it's the inevitable consequences of the type of system that we have now. But let's examine the question of privatization. And I think another thing that we have to think about is we should suggest to our providers of medical service, perhaps there are some services that every facility, such as every hospital, can't provide. If it's not life-threatening, perhaps we need to take a look at our Spokane hospitals, for example, and where they have the higher cost equipment already in place, can we afford, for example, to duplicate some of this at Kootenai Memorial? Do we have to become more flexible in terms of networking, so that if in fact these expensive high-tech machines are in place somewhere in the region and we don't have a life-threatening situation, we take advantage of patient utilization of those facilities, because the end result is going to be a reduction of cost. We will have less cost in capital equipment in our hospitals because of this sharing arrangement, and competition will take care of this process. So I think working together in that way, we can do a better job in terms of the cost of health care to we as individuals. So the final thing that I would like to suggest is that perhaps the federal government could establish a voucher system. And what they would do is they would give each of us as individuals a voucher rather than having a government-controlled situation. And we would take our individual vouchers, and with that we would determine the type of health insurance that we wanted, the package that we wanted, and we would apply that voucher, i.e. the equivalent of a government check, upon the cost of that insurance that we decided that we wanted to take. And I think this would, again, be a much more efficient system, because it would allow us to keep in place our individual choice that we have valued in our system. It would eliminate the necessity to have an extensive government agency created, and I think it would have the most timely and efficient flow of funds to the provider of health care services. And I think that this voucher system would also have the desirable impact of eliminating cost shifting that we now see going on by our governments, both state and federal, as they seek to shift this increasing cost of medical care onto the backs of we, the consumers. And it would also provide for increased competition within our insurance companies, because they would have to be more flexible in providing customized packages, because they would know that individuals were going to be much freer to make choice as to the type of product that they were going to purchase with insurance vouchers. So I think we would have an incentive for the insurance companies themselves to design more proficient packages of medical insurance. So I guess in closing, let me say that I truly do believe that the major resolution of this issue is going to be best handled if most of it comes from the private sector, and we continue to rely on the free enterprise system of this country that without question has given us the strongest country and the strongest economy and the finest health care system that the world has seen and will continue to see. And that although our system is not perfect, let's be careful before we take something that has been so world-leading and such a significant part of our economy and start to dismantle it, because I truly believe that we as individuals will be far worse off in terms of the health care that we can have access to and receive, and the lifestyles that we do enjoy, if we do this thing wrong. Thank you.